Most Americans keep bananas on their kitchen counter every single day. At breakfast, as an afternoon snack, in the grandkids' lunchboxes, in the diet of anyone trying to eat healthier. It seems impossible to go wrong with a banana. Most people think you just peel it and eat it, and that there is no way to do it wrong. But after more than 20 years of taking care of patients, I can tell you with complete certainty, there is. And these mistakes are far more common, far more silent, and far more serious than anyone ever imagines. I am Dr. Charles Garcia, and today I am here to show you 9 mistakes that most people make when eating bananas without even realizing they are making them. Mistakes that make blood sugar spike higher than it should, that cause bloating and gas, that upset the digestive system, that prevent the body from absorbing the nutrients in the fruit, and that in some specific cases can interfere with the effects of medications taken every day. Stay with me until the very end, because the 9th mistake is the most dangerous of all, and the one that almost no one ever talks about. Bananas are wonderful for your health, but only when you know how to eat them the right way. Let me tell you a story from my office a few years ago. A patient came through my door. I will call her Dorothy, 64 years old, a retired school teacher living in Tampa, Florida. Dorothy was a woman who took care of herself. She walked every morning, washed what she ate, drank water, went to bed at a decent hour. But she came to me with a set of problems that simply would not go away no matter what she tried. A bloated belly every single day, especially in the late afternoon. That heavy, tired feeling after lunch that makes it hard to think straight, difficulty losing weight despite staying active, and mood swings she blamed on stress, but that I noticed followed a very clear pattern. When I asked her to walk me through everything she ate in a day, we got to bananas. Dorothy ate bananas every day, multiple times. First thing in the morning, before anything else, an unripe greenish banana. Right after lunch, a ripe banana as a natural dessert. In the evening, banana with honey before bed. And sometimes a banana blended with milk as an afternoon snack. She never thought anything was wrong with that. Banana is fruit. Fruit is healthy. She was doing the right thing. But I saw 6 of the 9 mistakes I am going to show you today. And each one of them, by itself, would cause little trouble. All 6 together, repeated at that pace every single day, were causing every single symptom she was experiencing. I did not ask her to stop eating bananas. I did not change the amount. I only changed the type of banana for each time of day, separated the banana from the milk, moved it away from meals, and adjusted the evening timing. Just that. No diet, no medication, no going hungry. In 45 days, the bloating was gone. The afternoon fatigue after lunch had disappeared, and she lost 7 pounds without eating less, simply by eating smarter. That case stayed with me because Dorothy was someone doing so many things right. The problem was incomplete information. She knew bananas were healthy. She did not know that bananas are healthy when used the right way, at the right time, with the right combinations. And that is exactly what I came here to teach you today. But before I show you the 9 mistakes, give me just 1 second. If you have not subscribed to this channel yet, do it right now. Hit that red button below. Every week there is information like this, simple and practical, that can make a real difference in your health. Drop a like too, it helps me a lot. And tell me in the comments, do you eat a banana every day? Right? I eat bananas every day, or I had no idea down below. I want to know how many people here have this habit. Now let's get into what matters. The first mistake is eating an unripe green banana regularly, thinking it has less sugar and is better for diabetes or for losing weight. A lot of people believe this, and there is a partial truth to it. An unripe banana does release sugar more slowly into the bloodstream. But what nobody tells you is what comes along with that. An unripe banana is full of a type of starch that your stomach and intestines cannot digest properly. That starch travels to the large intestine where the bacteria ferment it. The result is gas, bloating, cramping, and a swollen belly. For anyone who already has a sensitive stomach, constipation, or chronic bloating, eating unripe bananas every day makes everything much worse. On top of that, unripe bananas make it harder for your body to absorb iron and zinc, 2 nutrients that are especially important for older adults. So if you have anemia or feel tired all the time, eating unripe bananas every day may be quietly working against your treatment. The simple rule is this: if you have a sensitive digestive system or anemia, always choose a ripe banana. Unripe bananas have their place, but they cannot be the right choice for everyone every single day. The second mistake is eating a banana immediately after lunch or dinner as a natural dessert. This habit is so deeply ingrained in American homes that it seems perfectly normal. But here is the problem. When you finish a full meal and eat a banana right after, you're putting more sugar into your body at a moment when it is already working hard to process proteins, fats, and carbohydrates from the meal. The digestive system gets overloaded, fermentation in the gut increases, gas builds up, and bloating sets in. On top of that, the sugar from the banana added on top of the sugar already entering from the meal pushes blood sugar higher than it should go. Over time, repeated daily, this habit contributes to poor blood sugar control, which is especially dangerous for anyone who already has diabetes or is borderline. The recommendation is to wait at least 30 to 40 minutes after a main meal before eating a banana. Even better, eat the banana as a standalone snack mid-morning or mid-afternoon, well away from main meals. The third mistake is blending banana with whole milk regularly. The banana milkshake or smoothie is a staple in many American households, especially for older adults who want something easy and nutritious. But this combination makes digestion much harder. Banana has an acidic internal composition, even if the flavor does not taste sour. When you blend an acidic fruit with animal protein like whole milk, the stomach has to work much harder to process both at the same time, and it ends up not digesting either one properly. The result is that heavy feeling in the stomach, acid reflux, heartburn, and bloating. This is especially problematic for older adults who already deal with reflux or gastritis. If you enjoy blending banana with a liquid, the best options are coconut water or unsweetened almond milk. Whole milk, if it is part of your diet, is better consumed at a separate time of day, away from banana. The fourth mistake is eating a banana at night before bed thinking it is a light and healthy snack. A ripe banana has a meaningful amount of sugar. At night, when the body is already slowing down to prepare for rest, the metabolism is less active. Sugar coming in at that hour is harder for the body to use as energy. What is left over gets stored as fat more easily than at any other time of day. Beyond that, banana stimulates the production of a substance in the brain that can actually keep some people more alert, especially those who are more sensitive to it. This can interfere with falling asleep rather than help. If you want to eat banana at night, and it is your preference, have at most half a banana and at least 90 minutes before lying down, never right before bed. The fifth mistake is eating banana alone before a walk or exercise session as the only fuel. Banana is often recommended as a pre-workout snack, and it does have real value for that, particularly its potassium content and moderate-release carbohydrates. But eaten alone, it creates a quick spike in blood sugar followed by a rapid drop, and that drop can happen right in the middle of your walk or exercise, leaving you tired, slightly dizzy, and unable to finish comfortably. The fix is simple. Always pair the banana with something that slows down the sugar absorption and keeps energy steady throughout the activity. A banana with a few walnuts, a small spoon of peanut butter, or a hard-boiled egg alongside it makes a much more effective pre-exercise snack than banana alone. The sixth mistake is eating too many bananas a day, believing that because they are natural fruit, there is no limit. Bananas are nutritious, no question. But bananas are also one of the higher sugar fruits in the produce aisle. 2 medium bananas already represent a significant amount of simple sugar for a single day. For people with type 2 diabetes, prediabetes, high triglycerides, or those trying to lose weight, eating 3 or 4 bananas every day can seriously interfere with treatment and progress. Natural does not mean sugar-free. It means the sugar is natural, which still enters the bloodstream and still needs to be managed. For most adults, 1 to 2 bananas per day at the right time and in the right combinations is the ideal amount. The seventh mistake is throwing away the banana with dark spots on the skin, thinking it has gone bad. This mistake causes many people to throw away the most nutritious banana in the bunch. A banana with a dark spotted peel, the kind that most people consider past its prime, is actually at its peak of digestive friendliness and antioxidant activity. As the banana ripens fully, the starch converts to simple sugar, making it much easier for the stomach and intestines to process. It also develops higher levels of compounds that support the immune system. Of course, if the banana smells fermented, shows visible mold, or has completely mushy flesh, it should not be eaten. But a banana with a dark peel and still intact flesh is not just acceptable, it is actually preferable, especially for older adults with sensitive digestion. The eighth mistake is peeling a banana and storing it in the refrigerator to eat later. Many people peel their banana in the morning, place it in a container in the fridge, and plan to eat it as an afternoon snack. It seems practical, but once peeled, banana starts losing vitamins rapidly. The browning that happens to the flesh is not just cosmetic. It signals that nutrients, particularly vitamin C and some B vitamins, are breaking down. On top of that, a peeled banana absorbs odors and flavors from everything else in the refrigerator. The right way is always to peel and eat immediately. If you need to store a banana for later, keep it unpeeled, at room temperature on the counter, and away from apples and pears, which release a gas that makes bananas ripen and spoil much faster. The ninth mistake, and this is the one that concerns me most after all my years of clinical practice, is eating bananas without knowing that they can interfere with certain medications taken every day. Bananas are rich in potassium, a mineral that is essential for the heart and muscles. But that same potassium can cause serious problems in people who take certain blood pressure medications. There is a common class of blood pressure medication widely prescribed to older adults in the United States that causes the body to retain more potassium as a side effect. When someone on that medication eats several bananas every day, potassium in the blood builds up too high. And too much potassium in the blood can cause irregular heartbeat, muscle weakness, numbness in the arms and legs, and in more serious cases can be life-threatening. Another important caution: there is an older class of antidepressant medication that does not mix well with foods containing a substance called tyramine, and banana contains that substance. People on that type of medication who eat large amounts of banana may experience a sudden intense rise in blood pressure. These interactions are real. They are documented in medical literature, and they are exactly the kind of information that should be in every appointment, but rarely is. If you take medication for blood pressure, for your heart, or for depression, bring this specific question to your next appointment. Doctor, is there any concern about me eating bananas every day with the medication I am taking? That 30-second question could protect you from something very serious. If you have made it this far, you already have everything you need to start eating bananas the right way starting tomorrow. Share this video with someone in your family right now. Send it to the person you know eats banana every day without thinking twice about it. It may be the greatest health favor you do for someone today. And tell me in the comments which of the 9 mistakes surprised you the most. Just write the number 1, 2, 3, 4, 5, 6, 7, 8, or 9. I read everything and I want to hear from you. Now let me share 2 real cases from my career that stayed with me and taught me things no medical textbook ever could. The names are different from the real ones to protect each person's privacy, but everything happened exactly as I will tell you. The first is a man I will call Richard, 61 years old, a retired contractor, living in Phoenix, Arizona. Richard had high blood pressure and type 2 diabetes that had been diagnosed 6 years earlier. He took his medications faithfully, went to his appointments, had his blood work done regularly. His numbers were reasonably controlled, but one night he woke up with his heart beating in an irregular, racing way he had never felt before. His arms were tingling, and he felt a weakness that would not go away for nearly an hour. His wife drove him to the emergency room. They ran blood tests. The doctor on duty found his potassium levels dangerously high and told Richard to follow up with his regular doctor as soon as possible to find out why. That is when he came to see me. When I sit with a patient and do a thorough investigation, I always ask about everything they eat. And it was in the conversation about food that the answer became clear. Richard had watched videos online saying that banana was the perfect fruit for diabetics because the sugar enters the bloodstream slowly. He believed it. He started eating 3 or 4 bananas a day, every day, completely convinced he was doing the best possible thing for his health. What he did not know, and what no one had ever explained to him, was that the blood pressure medication he was taking already caused his body to hold on to extra potassium on its own. When he added 4 potassium-rich bananas a day on top of that, the potassium in his blood climbed slowly and steadily until it triggered that frightening nighttime episode. I did not ask Richard to stop eating bananas. I asked him to have at most 1 small banana a day at the right time. In 2 weeks, his potassium was back to normal. No new medication, no hospital stay, just the right information arriving at the right time. Richard looked at me at his follow-up visit and said something I have never forgotten. "Doctor, I thought I was taking care of myself." And he was trying, genuinely. The problem was not a lack of effort. It was a lack of information, and the lack of one simple conversation that should have happened much sooner. The second case is a woman I will call Dorothy, a different Dorothy from the one I mentioned at the beginning of this video. A coincidence of names, a completely different story. 72 years old, a retired nurse, living in Tampa, Florida. Dorothy was remarkably active for her age. She did water aerobics 3 times a week, watched her diet carefully, did not smoke, did not drink. But for about 6 months, she had been experiencing a bloated belly that would not settle, heartburn that appeared especially in the evenings, and a digestive system that was alternating between constipation and loose stools with no regularity at all. She had done tests, seen other doctors, tried teas, probiotics, and dietary adjustments. Nothing produced lasting improvement. When she came to me and I took her complete dietary history, the banana blended with whole milk appeared every day after water aerobics, sometimes twice a day when she was hungrier than usual. Dorothy had a naturally sensitive stomach, and that daily banana and whole milk combination was creating fermentation in her digestive system that explained the heartburn and a disruption in her intestinal rhythm that explained the irregularity. She had never connected the two because the smoothie seemed so healthy, so natural, so harmless. I asked her to stop the banana and whole milk blend and replace it with banana alone or banana blended with coconut water if she still wanted a smoothie, and to have milk at a separate time of day. That was the only change. In 3 weeks, the heartburn had improved dramatically. In 1 month, her digestion had returned to regular rhythm. In 2 months, she told me she felt better than she had in years. No new medication, no difficult diet, just the correction of one simple habit that had seemed completely innocent. Dorothy said something at her follow-up that I love to repeat. "Doctor, I never imagined that smoothie was hurting me all this time." That is exactly how these mistakes work. Silent, daily, building up over time, until the body starts sending signals and no one can figure out where they are coming from. Now that you know the 9 mistakes, I want to leave you with what really matters. The right way to eat bananas so you get everything good that they have to offer. Because bananas have a lot of good in them. They have potassium, which takes care of your heart and muscles. They have magnesium, which helps you sleep better and reduces leg cramps, something many older adults struggle with. They have fiber that feeds the good bacteria in your gut. They have B vitamins that help your nervous system work properly. They have natural compounds that improve mood and reduce anxiety. And they have quality energy when consumed the right way. The banana is one of the most complete and most affordable fruits available anywhere in America. The problem was never the banana. The problem was always the way it was being used. So let me give you the simple protocol I recommend to most of my patients. In the morning, if you want to start the day with banana, have your full breakfast first and eat the banana after, never before anything on an empty stomach. Mid-morning or mid-afternoon, banana alone or with a small handful of walnuts is a perfect snack. Before a walk or any exercise, eat the banana at least 30 minutes before and always pair it with something. A few walnuts, a small spoon of peanut butter, anything that steadies the energy. After lunch or dinner, wait at least 40 minutes before eating a banana. Do not use it as an immediate dessert. And at night, if you want to, half a banana and at least 90 minutes before lying down, never right before bed. Ripe banana, yes, with dark spots on the peel, is the best for digestion and for anyone with a sensitive gut. Unripe banana, in moderation, for those without gas problems who want a lower sugar option. And banana never blended with whole milk. That is the simplest rule and the one that makes the biggest difference for anyone dealing with reflux or digestive issues. Follow this and banana stops being a problem and becomes a true ally for your health. We have reached the end of this video, and I want to leave a simple summary in your mind before you go. Mistake 1. Eating unripe banana regularly damages the gut and blocks nutrient absorption. Mistake 2. Eating banana right after a meal overloads digestion and spikes blood sugar too high. Mistake 3. Blending banana with whole milk causes reflux and digestive disruption. Mistake 4. Eating banana at night before bed makes fat storage easier and can disturb sleep. Mistake 5. Eating banana alone before exercise causes an energy crash mid-activity. Mistake 6. Eating too many bananas a day raises blood sugar, even though it is natural fruit. Mistake 7. Throwing away dark-spotted bananas means wasting the most nutritious and easiest to digest ones. Mistake 8. Storing peeled banana in the refrigerator causes rapid vitamin loss. Mistake 9. The most important, eating banana without knowing whether it interacts with your daily medications can cause serious heart and blood pressure complications. 9 mistakes, all easy to correct. None of them require money. None require a strict diet. None require going hungry. They only require information. And that is what I came here to bring you every single week. Simple, practical information that you can put into action the very next day. If this video helped you, if you learned something you did not know, tell me in the comments. Right? I want to eat right, and the number of the mistake that surprised you most. I read every message because every one of you here matters to me. Subscribe to the channel and hit the notification bell. Every week, there is a new video with practical, easy to understand health information. I am Dr. Charles Garcia. Take care of your health with quality information. See you next time.